My name is Siveshin Moodley. I'm a plastic surgery registrar, currently rotating my third year as a part of University of KwaZulu-Natal. And the common misconception of plastics is that whenever you think of plastics, you think of cosmetic enhancement. And plastic surgery goes beyond that. It's a collaborative surgical discipline, very collaborative with multiple other surgical disciplines being orthopedics, otorhinology, neurosurgery, it could be anywhere from pediatrics and cardiothoracics. And plastics, our mantra is restore function. Function always first, and thereafter we can restore dignity and hope to patients. So along with the components of plastic surgery is one of the components that's very close to home, which is congenital deformities. And that consists of craniofacial, and craniofacial is when you have individuals, it's usually pediatrics, that have craniosynostosis. And what craniosynostosis is basically fusion of the suture lines in the scalp or the skull. And those suture lines are there to help the brain develop. And when those suture lines are fused, the brain doesn't develop as normal. So in craniofacial, we get involved to actually release those suture lines and to allow that brain to develop normally. Along with craniofacial is the cleft lip and cleft palate. And this is basically a split in the lip and a split in the palate. And this holds quite true to a lot of stigma that comes with the clefting phenomenon, and craniofacial deals with a lot of the surgical pathology. So as a part of my registrar time, I am currently rotating in Pietermaritzburg for the year. And in Pietermaritzburg, it's a tertiary level facility, which is the flagship hospital, which is Gray's Hospital. And Gray's serves 5 districts and close to 4.5 million individuals. And in that district, we have a very small team that's working at Gray's Hospital, and that's inclusive of 1 consultant, 2 dedicated medical officers, and 1 rotating plastic surgery registrar. And our workload is basically distributed amongst 3 hospitals, and that's Gray's Hospital, as well as Northdale and Harry Gwala Hospital. And we're constantly in rotation between those hospitals, and often we actually have to travel between those hospitals, as well as balancing theatre slates, balancing emergencies, balancing our ward rounds, as well as seeing our constant ward patients. And as well, balancing our academics, which is a big challenge. At Gray's Hospital, we are linked with an operation that is really close to home. It's the Smile Foundation. So the Smile Foundation is a non-profit organization that is dealing mostly with cleft deformities. So this is in the pediatric population. And what they've started in Pietermaritzburg is actually adding an additional slate to the Pietermaritzburg slate. And it's usually on weekends, so it's after office hours. And they've funded the nursing staff as well as the anesthetic staff, and we are responsible for finding the patients to operate on. And we have the privilege of operating on these children at least 2 to 3 times every month. And this is just to keep up with our exhaustive waiting list of this condition. So that holds quite close to my heart. From an academic point of view, I'm currently doing my master's in medicine. My current topic is looking at the epidemiological profile of neurofibromatosis in the greater KwaZulu-Natal region. And neurofibromatosis is a genetic condition that is a nerve tumor that basically can affect the body from head to toe. One of the problems is it's often misdiagnosed. There's a great stigma surrounding the condition. And the neurocutaneous distribution of the disease is actually quite debilitating. So the purpose of my study is to actually create awareness with regards to the condition, allow for the peripheral hospitals to diagnose the condition properly, and redistribute resources towards this condition. So that is something that holds close to my heart, and I would like to pursue that further, and I'm currently still in the process of getting that published. So yeah, plastic surgery really is close to my heart. It is not only about aesthetics, it really can change people's lives. And yes, often the workload is quite intense, especially in Pietermaritzburg, where it's a very small team. But at the end of the day, we work beyond our hours and we do so out of our own accord, and it's just for the love of our discipline. So I am really appreciative to be a part of a great department. It has been an incredible journey, a big learning curve for me, but it's something that really is close to me, and I wouldn't change it for the world.